Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in Shoreview, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
It's great to have you with us again today. We're going to talk about yeast infections, also fungus infections, and many of them are related to intestinal issues. And so Dr. Jensen, my esteemed colleague here, is going to begin talking about them. What is the major culprit of candidiasis?
Thank you, Dr. Lala. Well, the major culprit of candidiasis is actually it's an overgrowth of the Candida albicans, and it proliferates in the intestines. It causes dysbiosis, enters the blood, and results in systemic disorders. Now let's talk about this a little bit. When you're talking about in the intestinal tract, really as people, what we find is that we have more bacteria and yeast and other types of organisms within us, so that we're actually more of a community than just a person. But what happens is, through the intestinal tract, there's a lot of flora in there, which is just a word that means about all the bacteria, the protozoa, and the yeast that live there. And basically, it's a fight for territory. And so what we're trying to do is work with those things that are more symbiotic with us, rather than being a parasite to us. And so what we're looking at with yeast infections is it's more of a parasite to us, in that the overgrowth in our body creates a lot of symptoms that are deleterious to our health. Now, one of the things that it can cause is dysbiosis, and dysbiosis it's different from eubiosis. Eubiosis is the healthy balance of bacteria, and dysbiosis is an unhealthy aspect to that. And dysbiosis can cause things like bloating, digestive problems, and a whole myriad of things that we're going to talk later on in this show. However, what happens is when Candida has an overgrowth in there, what it can do is it starts to almost like drill holes in the intestinal tract, trying to enter into the bloodstream. And when it does that, it enters in the blood, it results in systemic disorders, which then add to a great deal of the problems that we can have.
So it spreads through the blood then?
Correct. Mm-hmm. Correct. So Dr. Lala, how about some of the symptoms of candidiasis?
Some of the symptoms, interestingly, would you believe multiple sclerosis, chronic headaches, depression, chronic depression, lethargy, easily agitated, hyperirritability. These are people with chronic issues, memory loss, and certainly here we would be talking about dementia and Alzheimer's. Cognitive dissonance, meaning that instead of me being able to typically process my thoughts from 1 to 2 to 3 to 4, from A to B to C to D, that my thoughts are coordinated, I begin having dissonance. And so when that yeast and fungus gets up into the blood, it can go up into the nervous system and the brain, predisposing us to multiple sclerosis, to headache issues, to depression, because then it begins altering what are called our neurotransmitters, which are hormones that have a great deal to do with our regulation of different body activities. Lethargy, certainly if the internal system of my body isn't functioning well, I'm not going to feel very energetic. I'm going to become easily agitated. I can become easily hyperirritable. Just anything will set me off. Memory loss, because these bugs, these fungi and viruses are infiltrating my brain and my nervous system, so I'm not going to think as well as I should. And of course, that's going to predispose me to cognitive dissonance.
Now, what you just went through, Dr. Lala, was a number of symptoms that were all related to the nervous system. And one of the things that's interesting is that Candida also, when it blooms inside of the body, it gives off upwards to 70 different neurotoxins. And not only can that cause a lot of these also, but one of those things that was not mentioned is Alzheimer's. And from what we're looking at is with these neurotoxins in there, we have inflammation that can be caused inside the brain. And in which case, if there's inflammation in there, it could also be an exacerbation of some of these problems with kids that are having these behavioral problems also.
Attention deficit syndrome.
Yes. As
ADD.
Yes. Mm-hmm. And so when we're looking at that.
Some of the symptoms that involve the gastrointestinal tract are chronic heartburn, the gastritis, colitis, or inflammation of the bowel, excessive gas, constipation and or diarrhea. And of course, if there's going to be gas, there's going to be bloating or abdominal distension. Now, usually that gas is putrid in nature, that it is very, very smelly. So when those yeast or fungi are in my intestinal tract, then they're going to predispose me to chronic heartburn, chronic gastritis, chronic colitis, chronic issues with gas, chronic issues with constipation and or diarrhea, bloating or abdominal distension. Now, Dr. Jensen is going to look at some of the possible symptoms that are related to candidiasis when it is involving or it has proliferated and systemically spread to the genitourinary tract.
Thank you, Dr. Lala. Well, when we're looking at candidiasis, a lot of it seems to be related to inflammation. And so when we're looking at inflammation that's in the genitourinary tract, we're looking at a yeast infection that is most commonly called vaginitis. It can cause things such as cramping. Endometriosis can be a big problem with that also, which we've talked about in another program on female problems. Endometriosis is actually, it's a proliferation of tissue that fills the pelvis and can actually go from the uterus up into the fallopian tubes. Quite painful.
So often then, with many of the women that are suffering from endometriosis, it's being not adequately diagnosed or misdiagnosed when they're failing to understand that it might, in fact, be related to a yeast infection.
Yeah, yeah.
And interesting.
It's very interesting. And one of the things that's, when you look at yeast infections, they can be, in some cases, troublesome to treat medication-wise because there's a difference in cells from a bacteria to our own cells. Our own cells are eukaryotic. And the bacteria cells are different so that you can use a drug that can wipe out bacteria and not be a problem for ourselves. However, yeast cells are also eukaryotic, and so by using some of these antifungal drugs, you can only take a narrow band of that drug because it also kills off your cells as well. It's almost like using chemotherapy. So in which case, it's better to use some of these natural solutions, such as avoiding some of the foods that may cause its proliferation, and just having more of a balance in the body that allows your body's own defenses to take care of it, as well as probiotics to take care of it, which have their own defenses against yeast. Interesting
when they come down with some type of an infection, even an adult or a child, and they give them an antibiotic, then all of a sudden they clean up or clear up the bacterial infection, but all of a sudden now we have candidiasis then, or a yeast or fungus infection, because it went and destroyed the normal defense, the good bacteria and viruses to defend the body, and all of a sudden they proliferate.
Absolutely, absolutely. And it's interesting because in my generation, with things like chronic sinusitis and with hay fevers and things like that. In order to control that, they used to prescribe penicillin, which is an antibiotic. And so what they're doing is these young kids were given a lot of penicillin as they were young. They have this candidiasis that they're dealing with.
So it's really then an acquired immunity deficiency issue then.
Yes.
They acquire it over. Okay, well, what else did you?
Well, then we also have going along this whole thing of inflammation. Cystitis can also occur, which is inflammation that's in the uterus. Okay,
So-
with some cysts.
And that could be also cystitis or the urinary bladder infections, or there's chronic urinary bladder infections. And they think, oh, I don't know where I picked that up. Well, it probably came out of the diet or some other issue, but so they just throw a drug at it rather than say, well, what's the cause of this that it reoccurs in this woman's life?
Right, right. So many times diseases are due to lifestyle and can be changed by lifestyle. You have to look at most of these drugs were developed out of natural substances that came out of the foods that we eat. And really, our first drug of use is really the diet that we have. And by regulating that diet, we can change a great deal of this. And sometimes we get beyond that diet and need to have nutrition helps with that, such as supplements. And sometimes those supplements have to be done in therapeutic doses so that we can get ahead of the game. So then we can, some further genital urinary tract problems would be with urethritis, which is inflammation of the urethra. You can have that infection climb all the way up the ureters, right into the kidneys, giving kidney infections also that go along with the bladder infection.
These chronic nephritis issues, which then lead to another whole plethora of other health problems when the kidneys aren't functioning correctly.
Certainly. And for you out there, a nephron is the functional unit within your kidney. And we're born with basically billions of these within the kidneys. And what happens is through disease processes, we start to have dysfunction of these nephrons to the point that we start to have less function of the kidney in degrees. And it's not until it gets to a level in which it starts to create a big problem that many times these things are diagnosed, and now you're starting to look at the possibility of kidney failure. So it's a process.
And it's a process of going down and down, devolution, where it's going down and down, and it's accumulative, that it doesn't just show up overnight.
Right. Well, here's when we're a youth, you know how kids bounce back from things so fast. As a youth, our organs and everything is functioning at 400%. 400% of what they need to be. So they bounce back that much quicker. Now, as we age, that starts to go down to somebody that's say a little bit older than me. They've started to get down to like just 100%, and then it starts to get less and less as we age or mature. And so, what you're finding are those people who are in their 40s are starting to find that they're not recovering as fast. And they start to need some helps in that.
There's no need for that either, is there?
No. Another thing that this can cause is irregular menstrual cycles also. And so this really affects you as a whole. So then let's look at some more of the generalized symptoms for candidiasis. There's fatigue, generalized fatigue. Well, if you're dealing with this inflammation all the time, with sapping of some of the foods that you're eating or going into feeding this candidiasis, it changes your metabolism, changes your nervous system, so fatigue can result from that, as well as joint pains and stiffness.
And we see a lot of that because most of the people that we see have gone to either a chiropractor or a massage therapist or physical therapist with limited good positive results. And the reason is that we start looking at it. Could it be, for example, could their arthritis, could their fibromyalgia, could it be related to a yeast infection? And many times it is, and they fail to diagnose it.
Absolutely. And so they're coming in with these aches and pains that just don't go away with the adjustments? Well, it's because they have chronic inflammation. Interesting thing about in our series that we did on inflammation, when we find chronic inflammation, it's the doorway towards autoimmune diseases also.
That's probably a good idea. Now that you mentioned that, could you tell the folks how they could go out and pick up that program, say an inflammation or any other program that we've done over the years?
Sure. If you go out on housecalltv.org, that's the website that we have that's related to this television show. There's a section where and when to watch, and there's a little link on the top of that says if you want to watch the show or stream, click here. And click there, and it comes up a list of shows that are on there, which are actually streaming videos of this show. And I would, if I was interested in, say, this inflammation show, that's out there. You can go and look for inflammation and click that, and you'll be able to watch that show right online.
So we have really out there an encyclopedia of health that they can go out in there and find any subject on health and nutrition.
We've tried to supply them with a library
And it's
of
based,
subjects.
It's based on science-based nutrition, not voodoo nutrition.
Right.
Okay. What are there? Any other symptoms related?
Okay, so we went through joint pain and stiffness. There's cold hands and cold feet, so it starts to affect your blood flow to that. Loss of libido, so your sex drive can be affected by this. Increases in body hair, so what we're looking at is hirsutism. Is the name of the symptom, and it's an increase of testosterone. So it's throwing your balance of hormones off also. And then food cravings. It's interesting that the yeast will actually give you a desire to eat those foods that help proliferate the yeast. I guess if they're happy, you're happy, and so we start to use it as a drug, but it actually exacerbates the symptoms.
So it would be foods that would have yeast in them also?
Foods that have yeast in them, and here's an interesting thing, is there's a lot of times with the B-complex vitamins, many manufacturers manufacture them within...
Yes, we should say most B-complex vitamins are manufactured with yeast.
Yes, yes. So they're manufactured by the yeast, and they don't necessarily take the yeast away from the B vitamins, they just put it into the pill with it. So what you're doing is you're re-inoculating your system or giving... Let's put it this way, if you needed to feed your liver, by Chinese medicine standpoint, in order to get those raw materials for feeding your liver, you would eat liver. And therefore, it's coming with the nutrients that are balanced for the liver. So the same thing is if you're eating yeast that have been killed or died off, you're taking that and you're actually feeding the yeast with raw materials for the yeast.
It's interesting, the number of people that come to us who we find that they have yeast infection. And we say, well, are you taking vitamins? Yes. Well, when you come in, please bring them along. And so we look at them, and here they have candidiasis, and here the chiropractor or the nutritionist has been giving them yeast-based B-complex vitamins. So they've been actually making them worse.
Yep, or what they've done is they've gone out, they've read an article or watched the show and decided that they'll go to just a health food store themselves and start picking things off the shelf and not know what not to pick.
And there's a greater profit in a yeast-based B-complex vitamin than there is in a non-yeast-based.
It's cheaper to create.
So they hire much higher markup.
Right.
How about, are there any allergic symptoms related to candidiasis?
Well, as we were talking before, there's inflammation, and when there's inflammation, there's some type of irritation that's been going on in there. And your immune system is already under attack.
So it's compromised then? The yeast infection compromises it?
Right. Whereas a difference between that and probiotics, the bacteria that work symbiotically with the body, they actually tend to amp up the immune system.
That's interesting too, that many of the probiotics, a lot of people are taking probiotic compounds, but many of them we find in independent laboratory analysis do not have the ingredients in there that the label says it does.
Or probiotics are live organisms. And so many times these are, you look at it and it's not live organisms. Then you're basically just taking something that doesn't do any good. So unless if there's a lot of people who are taking, say, acidophilus, which is a probiotic, they're taking it within a dairy base, such as in yogurt. And some of these people have food sensitivities to yogurt.
And yeast love dairy products.
Yes, they do.
Like they love sugar too.
Yes, they do. So that's one of the things. On from hay fever and sinusitis, you can have earaches.
So many of the problems with these middle ear infections that these young children have could be related to yeast infections?
Definitely. My own son, my oldest son, when he was young, he had an ear infection every 2 weeks. And once we realized that it was dairy, Simon goes, "Doctor, what are you thinking?" Once we took him off the dairy, he didn't have ear infections after that. So we found that was a big component to that. So there's earaches, hives, which histamine reaction, asthma. Of course, now they're creating inflammation in the lungs.
And it's interesting, the number of people that consult with us for asthmatic issues. And we say, has anybody ever talked to you about a yeast or fungus infection? Has anyone ever done a candida antigen titer on you? Has anybody ever done an organic acid analysis on you, which is certainly a way to easily determine this, and inexpensively too, in comparison to so many other medical costs. And they'll say, and then we do those simple blood and urine tests, and all of a sudden they say, well, there's the answer. And they say, you mean they've been treating me wrong all of these years? Yeah, they have been. You know?
And so, you think that it might be less expensive sometimes going somewhere else where they're not doing the tests. And it ends up costing you a lot more in the long run over years.
There are a lot of investments that look inexpensive, but they're highly costly because they do not adequately diagnose the individual.
Right. And so there's also some things where it can cause actually some food and chemical sensitivities. If you look at it in the intestinal tract, you have between the cells, you have like little connectors, to help the cells so that nothing gets in between. And those are called desmosomes. And what happens is when you have inflammation, that these cells swell up, they'll actually almost pull themselves apart, and that creates holes within the intestinal tract. And so in that case, these things have a much easier way of getting inside. And when they create holes through the inflammation, sometimes we have food particles that haven't been completely digested yet. And they make it through the barrier between outside and inside, and therefore start to create an immune reaction to the food. So then we create food sensitivities.
So would that also be true then of toxins that should be normally eliminated through the large bowel? That those toxins are also being absorbed in this, what is that, the distal end of the small intestine where that goes on?
The distal end of the small intestine is where we absorb a lot of our nutrients that way, but really it could be throughout the intestinal tract.
So people with chronic digestive issues could in fact have a yeast fungus issue that's causing them.
Sure, and when you're looking at irritation of cells, to take this another step further, most of our cancers are from epithelial cells. Epithelial cells are the cells that are found on the insides of our membranes. It's everything that creates a barrier. Actually, our skin is made up of epithelial cells. They have many different forms of epithelial cells, and those cells are actually almost a pluripotential cell, in that if you irritate it, or change it where it is in the body, it can actually change to a different type of a tissue. And so what happens is when you irritate those cells enough, they start to change. And if we have a cell that changes to a different type of cell in the wrong area, we call that a cancer. And so if you have an irritation, a chronic irritation of the intestinal tract, that's where we start to find things such as colon cancer that comes about from that.
So we're talking about really issues that could be preventable.
Yes, definitely. There's a viral connection to all this. There's a Epstein-Barr virus. It's a form of the herpes virus. Epstein-Barr virus is believed to be a causative agent in infectious mononucleosis. It shows low levels of essential fatty acids are very low after the illness, and similar to low levels found in multiple sclerosis patients. Funny that we find in multiple sclerosis patients, we can find a great deal of candidiasis within them also. This virus interferes with the body's ability to metabolize essential fatty acids, causing a partial breakdown of the body's immune system. And so an acute episode of this infection with the Epstein-Barr virus during adolescence could leave the door open to chronic illnesses, such as multiple sclerosis some years later. Mm-hmm. And of course, we're looking at that where there's inflammation within the nervous system.
So we're really talking about finding the cause, not treating the symptoms. That's really the case. And
right.
we've also been talking here about, very briefly, about environmental toxins. Environmental toxins cause what we call metabolic poisoning, and they damage the brain, they damage the central nervous system, predisposing us, as Dr. Jensen has just said, to multiple sclerosis, many of these autoimmune disorders, digestive issues, as well as Parkinson's. So toxic or toxins, poisons, cause metabolic poisoning. They interrupt the body's metabolic pathways, damaging the brain, central nervous system, including the myelin sheath. That's the sheath that covers our nerves, at least our white nerves, not our gray nerves. The defect then in multiple sclerosis, which predisposes people to autoimmune disorders, digestive issues, aging, and Parkinson's disease. The individual's body, our bodies are designed, God created them to manufacture antibodies to these foreign substances which cross-reacts with the myelin sheath, thus damaging the nerves and thus causing symptoms such as, or diseases such as multiple sclerosis and digestive issues. Now, some of the aggravating issues with these chemicals are chemicals in food and water, carbon dioxide, diesel fumes, fumes from gas or water heaters, from solvents that are being used, from aerosol sprays, from chipboard, from foam in furniture and carpets, and mold produced by fungus. Now, let's bring up this issue, too, that the dentists don't want to hear anything about unless they're in the business of removing amalgams and replacing them. Toxicity also occurs within the body from mercury dental amalgams. Mercury is a highly toxic heavy metal. Its toxic reactions are similar to multiple sclerosis. If you have an issue with multiple sclerosis or there's a hereditary predisposition to that in your family, you need to go out. At least I would recommend that you go out on our website and download that program on multiple sclerosis. Now, mercury in itself binds to DNA cells, desoxyribonucleic acid. That's our genetic typing, and cell membranes. It causes then cell distortions and inhibits cell functions. So again, now in multiple sclerosis patients have been found to have 7 times higher levels of mercury in their cerebrospinal fluid, that's the fluid that surrounds the brain and the spinal cord, as compared to healthy patients. The same holds true when serum and hair metal biopsies or analysis are conducted. So in all of our multiple sclerosis patients, at least the ones coming in, we make sure that we do not only a blood analysis, but a hair mineral biopsy as well. So then drugs have both immediate and long-term effects. Antibiotics destroy, as we've said earlier, the good bacteria as well as some of the bad, and this is a very serious issue. But the key is to know, and when we know, we can start to manage correctly. So again, the absence of symptoms does not necessarily indicate the internal presence of wellness. If you want to have good health and long life, then you need to have some internal biochemical tests performed that are going to let you know where your body is at so that you can begin to manage it. Thank you. Thank you.
House Call has been brought to you by the Fellowship of the Great Physician. For further information, telephone us in care of Dr. Lala or Dr. Jensen at 651-484-8521 or visit our website at housecalltv.org. Thank Thank you for joining us today.